The American Red Cross has declared the first ever blood crisis amid the Omicron surge. Many local blood centers are urging donors to help. But KCTV5's Greg Payne explains one group is prevented from trying to help.
Local blood centers are trying everything possible to get people to come on out to help with this blood shortage. But there's one group in particular that feels as though they haven't been given a fair opportunity to help in trying to prevent this shortage. While many people around the country can just walk into a local blood donation center and give blood, members of the LGBTQIA+ community face an obstacle. Currently, sexually active gay or bisexual men must abstain from sex for at least 3 months before they're allowed to donate blood. That was shortened from 12 months in 2020 because of the pandemic shortage.
Any type of restrictions are still an act of discrimination against a group of people.
The restriction came out of the AIDS crisis of the 80s.
So I think it upholds the idea and the stigma that people have on not only the LGBTQ community at large, but especially gay and bisexual men, that, their practices are unsafe.
The FDA is conducting a study on possibly changing the policy, something Kansas City, Missouri LGBTQ Commission Vice Chair Justice Horn hopes happens.
I think when you are out there, sounding the alarms for the emergency, you can't, be selective on what exactly that aid and that help looks like.
A feeling that members of the Community Blood Center of Greater Kansas City agree with.
So we do stand behind the FDA's study on that. We urge them to act quickly so that we can welcome those donors into our center again, because we know that we need it.
LGBTQ advocacy group GLAD notes that if this restriction was lifted, more than 350,000 men would be able to donate. Reporting in Kansas City, I'm Greg Payne for KCTV5 News.